This oral solution is used to replace fluids and minerals lost due to diarrhea and vomiting. It helps to prevent or treat dehydration, which is important for the normal functioning of the body. It is important to take the correct dosage and drink the solution at the optimal time to ensure the best results. When taking Kinderlyte oral solution, it's important to follow your doctor's instructions or the directions on the product package. Some brands need to be mixed before using, while others should not be mixed. If your liquid is a suspension, make sure to shake the bottle well before each dose. For the powdered form, mix it in water as directed on the package and stir until completely dissolved. Do not heat the product unless the package states that it is okay to do so. The dosage of Kinderlyte oral solution depends on your medical condition and how you respond to treatment. Avoid drinking fruit juices or eating foods with added salt unless directed by your doctor. If your condition worsens, lasts for more than 24 hours, or if you experience severe stomach/abdominal pain, blood in the stool/vomit, a fever, or signs of dehydration such as dizziness, decreased urination, severe thirst, very dry mouth, or seizures, it's important to consult your doctor. If you suspect a serious medical problem, seek medical help immediately. If you experience mild nausea or vomiting after taking Kinderlyte oral solution, try taking it slowly in small amounts with a spoon to reduce these effects. If these effects persist or worsen, it's important to contact your doctor or pharmacist promptly. Remember, if your doctor has prescribed this medication for you, they have weighed the benefits against the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to seek immediate medical attention if you experience any serious side effects such as dizziness, unusual weakness, swelling of ankles or feet, mental or mood changes, or seizures. While it's rare, a very serious allergic reaction to this product can occur. If you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing, seek medical help right away. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Kinderlyte oral solution, it's important to discuss with your doctor or pharmacist if you have any allergies or if you are allergic to any inactive ingredients in the product. If you have difficulty keeping fluids in your stomach, trouble urinating, or intestinal blockage, it's essential to consult your healthcare provider before using this product. Additionally, inform your doctor or dentist about all the medications you are currently using, including prescription drugs, non-prescription drugs, and herbal products, before undergoing any surgical procedure. If you are pregnant or breastfeeding, make sure to seek medical advice before using this medication. When taking Kinderlyte oral solution, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, be cautious of interactions with mineral supplements, such as potassium, while using Kinderlyte oral solution. Always consult with your healthcare provider before making any changes to your medication routine. If someone has taken too much of Kinderlyte oral solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can call 1-800-222-1222 for their local poison control center, and in Canada, residents can contact a provincial poison control center for assistance. As you start feeling better, you can begin to eat gentle, plain foods like rice, bananas, toast, boiled potatoes, or other foods suggested by your doctor. It's important to keep all your medical and lab appointments. The Kinderlyte oral solution is not applicable for use. It is important to follow the instructions and guidance of a healthcare professional before using this medication. If you have any questions or concerns about the uses of this medication, be sure to consult with your doctor for more information. When storing Kinderlyte oral solution, make sure to check the storage information on the package. If you're unsure about how to store it, you can ask your pharmacist for guidance. It's important to keep all medications out of reach of children and pets. To properly dispose of Kinderlyte oral solution, do not flush it down the toilet or pour it into a drain unless instructed to do so. When the product is expired or no longer needed, make sure to discard it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.